All right, fourth quarter, you get a renewal. It's double digits. It's the definition of insanity. We continue to do the same thing. Your broker probably markets this to the same other 3 or 4 carriers. That always happens. You talk about what plan designs you can take out of the system, and you pass more cost on to your employees. You're asking them to pay more for a crappier plan. This is the year we're going to stop the insanity. Joe, tell me who you are, who your great company is, and tell us how a MERP solves this issue.
Thanks, Lester. Joe Donovan here, CEO of a company called The Difference Card. And first and foremost, Lester, it drives me crazy when people, whether it's brokers or benefits folks, cost shift and call it savings. Raising deductibles and raising copays and just increasing your employees, your most valuable assets out of pocket, just put your employees in a really tough spot, even though the company may win by saving a little bit of money. And with our approach and the MERP strategy, you can almost have the best of both worlds, Lester, because leveraging a MERP allows you, in my opinion, in our opinion, to build the most cost-effective health plan for your employees. And it's about as close, Lester, to self-funded as you can get while still being on a fully insured chassis.
So we got the concept of it's got something to do here. Now explain what it actually does.
Yeah. So how does it save money, right?
Right.
Essentially, we leverage, the cost savings that accompanies a fully insured plan when you get really high copays and really high deductibles. That lowers the fixed cost to the carriers. And then on top of that stripped down plan, we layer in the difference card. And the difference card acts as a funding mechanism to bridge the employee's benefits back to that rich level that they had before. So once again, we're not just passing cost onto the employees. Yes, we're buying a more cost-effective plan, but we're layering the difference card on top of that plan. And just like self-insurance, Lester, lower fixed cost, we have this variable component. So the difference card acts as that variable cost component, which is a promise to pay, not a prepay. And that's the big difference between traditional fully insured groups, which drive me crazy, is you're prepaying whether your people go or not. With the difference card, it's a promise to pay if and when the employee goes.
And the reality of this is, if we understand the stock prices of the major insurance companies go up because they make a profit, this is allowing the employer to become that insurance company and make some of that profit instead of just passing it on and then nobody going. So this is a win-win. The employee doesn't feel that financial burden of that increased deductible. And if they don't spend it, like most of the time they don't, the employer keeps that dollar.
100%.
Love it. Now, I guess, in a way we talked about it, but talk about how this allows the employer to actually better the benefits.
Yeah, I think one of my favorite parts about the difference card is just like true self-insurance. Again, you're gonna notice that theme here. You have the flexibility to build whatever plan design you want. Typically in fully insured, especially when you get under 100, you're stuck to a cookie cutter set of benefits. And you know who designs those cookie cutter set of benefits is the big insurance company. And they're really smart people, and they design plans that work for the insurance company. With the difference card, it allows you to kind of strip that plan down and build it back to what works best for your organization, as opposed to just what works best for the insurance company. So Lester, we have clients who improve PCP copays. They improve tier 1 medication costs because they want to incentivize folks to get their checkup. If something's hurting, because obviously the preventative is free, but something's hurting, go to the doctor. Get it taken care of now before it becomes an issue down the road. So a lot of really cool stuff we can do when it comes to building a health plan that works great for that employer. And then one thing we'll dive deeper in on the webinar November 7th is the reporting. Any broker or client knows in the fully insured under 100 space, if you get any reporting at all, you're lucky. With the difference card, we report on everything that we code the card for. It's HIPAA compliant, it's in aggregate, but as a broker consultant or HR director or CFO or benefits person, data is power. And we empower our clients and our broker partners with that data to make a more educated decision year in, year out.
Better benefits at a lower cost is possible. If you're an advisor, if you're an employer, and you just renewed and thinking about renewing for your January 1st renewal the normal way, you have to watch Joe on our webinar. Click below. This is the easiest strategy that could put money back in your pocket you'll ever see. We're looking forward to hosting you, Joe. We'll see you in a couple weeks.
Thank you, sir.